Hey listeners, welcome back to the Daily News Recap. Today, the headline is that the Trump administration is withholding further federal Medicaid funding for California and Minnesota because of alleged fraud in their public health insurance programs. That means that both states will see a reduction in the federal dollars that help pay for services under Medicaid, the program that provides healthcare coverage for low-income adults, children, pregnant women, and the elderly. Medicaid is a joint federal-state program, and the federal government pays a large share of the costs. The federal share is called the federal matching rate. States are responsible for the Zoom calls for the kids that Sprint shows. If the federal government declares a problem, like evidence of fraud or abuse of the program, they can freeze or withhold further payments until the issue is resolved. In this case, the Department of Health and Human Services cited fraud claims that could involve improper billing, identity theft, or other financial misconduct in California's and Minnesota's Medicaid programs. The Trump administration has typically emphasized tighter federal oversight of state programs, and its step here is part of a broader push to crack down on what it sees as waste, fraud, and abuse. California and Minnesota are two of the biggest beneficiaries of Medicaid in the United States, together serving millions of residents. The withholding decision could affect thousands of low-income families in both states who rely on state-funded health services. In addition, the states have said they are working to address the alleged fraud and that they plan to restore full funding as soon as compliance is confirmed. It's not the first time the Trump administration has taken action over Medicaid issues. In previous years, the Department of Health and Human Services issued audits and held hearings to check for fraud and abuse, and the White House has publicly announced increases or decreases in funding tied to state compliance. The recent withholding specifically comes after an investigation identified potential gaps in verification and claims processing in the two states' programs, creating concerns about whether the money was being misused. The federal government's stance is that any bias or sloppy enforcement of rules can cause financial harm and that it has to enforce its own federal-state agreements. Now, what does this mean for local residents? Well, many Medicaid beneficiaries depend on their state for help with expensive treatments, first-line medicine, and other necessary healthcare services. The pause in federal funding could lead to a shortfall in hospital reimbursements, medication costs, or provider reimbursements. Some health providers in those states may need to look at how to cover costs while the funds are withheld. It might cause a ripple effect in hiring nurses, pharmacists, and other support roles. For the federal government, it's a thorny policy tool it can use to try to plug gaps in oversight and ensure the program is used responsibly. Finally, both California and Minnesota officials have indicated they are evaluating internal audit processes to address the allegations. They're setting up stronger verification protocols and have pledged that if the state can demonstrate that fraud is an unzip file and there is a plan to cure any wrongdoings previously detected, the federal funds will be restored. The wait time for that sort of verification can be weeks or months, but the states want to maintain the compliance posture. To wrap up, the Trump administration's decision to withhold Medicaid funding for California and Minnesota is a big reminder that the federal government keeps a close eye on state programs. Fraud, abuse, or lack of oversight can cost states money, and this move will test how well the two states can solve the issues and come back to resume full federal support. Stay tuned for more updates, and thank you for listening. Stay informed and keep caring for your community. That's your news recap for today. Until next time, keep your minds open and your hearts kind.